Unfortunately, that last video about obesity got massively shadow banned because I used words that I think the algorithm thought I was shaming about, which is the exact opposite of what I'm going to do. Today, I want to talk about the body mass index, Beyond BMI, how to redefine obesity with this article from Nature magazine. So the body mass index is a pretty crude measure. All it does is divide your weight by your height squared, but it has been the standard for decades. However, it doesn't measure body fat, and it doesn't tell you how healthy someone is at that height and weight, especially regarding their age, race, and gender. But in a rush clinical setting, it is a really useful, fast tool, and that's why it's been so important for so long. The origins of the body mass index are pretty interesting. It was this Belgian mathematician astronomer 200 years ago named Adolphe Quetelet, and he obsessed over characterizing the average man. And so he took a bunch of height and weight readings from mostly Western European white males and found that weight roughly corresponded with height squared. And he divided those two numbers into a number that started to become known as Quetelet's index. Then, more recently, in 1972, there was American physiologist Ansel Keys who looked at several height and weight ratios and found that the best predictor of body fat was Quetelet's index, and so it got renamed to the body mass index. This was certainly an improvement over the general height-weight tables that were used at the time that were even cruder and set the standard for what was normal and healthy. So at the population level, BMI is useful. It does correlate to risk of death. But when you get down to the human level, as one researcher, Susan Janowski, says, BMI is a somewhat crude metric for determining health risks. A recent study published in July found that the risk of death for adults in the overweight category was similar to that of people at healthy weights, echoing early analysis. Another study found that about 30% of participants with obesity had good cardiometabolic health, defined by factors including blood pressure and cholesterol levels. And around the same percentage of people with a healthy BMI was deemed cardiometabolically unhealthy. Of course, all of this is complicated by other factors such as gender. Women tend to have a better distribution of fat in the buttocks and hips regions, while men tend to accumulate it in the abdomen, which is worse to have fat in the abdomen. Also, these studies were mainly done in white people, and it doesn't correspond to everybody. In fact, in Asia, they had to lower the BMI index because it didn't correlate as well for the actual health risks to people. Really, clinicians should be looking at cholesterol, blood sugar, and even family history and genetics, which plays a large part in obesity and the related conditions, but they don't really have the time. For alternatives, right now there's a big project by about 60 obesity specialists looking at the fat content of different organs and coming up with diagnostic criteria. They're probably going to release their report next year. But the most widespread alternative right now came from an actual obesity clinic in Edmonton, Canada, where they had about 2,000 people on the waiting list. And they were getting sick of using BMI because it wasn't a good way to prioritize who needed urgent care. She said, Sharma says, "It tells me how big you are. It doesn't tell me how sick you are." They co-created a 5-step system called the Edmonton Obesity Staging System. And a person who has several weight-related conditions, such as difficulty moving, heart disease, and anxiety related to obesity, would be at a higher stage than someone with the same BMI, but with fewer or less severe health conditions. This system got folded into the National Canadian Clinical Guidelines for Obesity, and now it's being rolled out in Chile as well as Ireland. So alternatives to the body mass index are being developed, but as the lead person here says, translation into clinical practice will be a large hurdle to overcome.